Hello and welcome to yet another episode of Mwalimu Kipepeo. Many thanks for joining us today. I'm your host, Jasmine Omboi, and this episode is all about the common cold and flu through an interview with Dr. Adil Waris, who is an expert on this topic. So get ready to listen and learn. Journalists are always out searching for the truth in every story. That truth is meant to help us help you understand issues better. Well, I met my guest today through such a quest, and I enjoyed the interview so much that I had to split it into a two-part series on a weekly health segment that I had. The information was too much and also important that series is now my most viewed story done on YouTube. And I am forever grateful for the doctor who was so kind with a lot of information and was gracious enough to freely teach me without any reservations. So I hope you get blown away like I was as we all struggle to keep warm this season. Welcome, Dr. Adil Waris, to this episode of Mwalimu Kipepeo. I'm so excited to have you here with us, and that's why I have so very many questions for you. But before we get there, I'd like you to introduce yourself to everyone for those who don't know you and would like to know who you really are. I know who you are, but I'd like other people to know who you are so that they get comfortable in now hearing what you have to say. So, what do you do? And what is your passion in life?
Thank you for these questions, Jasmine. I am a consultant, pediatrician, stroke, chest specialist for children. So what I do is I specialize in all kinds of pediatrics, but at the same time, I'm also trained in treating stubborn coughs and colds that just don't go away. So children who have asthma, TB, bronchitis, children who are getting recurrent coughs and colds, a lot of sneezes and snoring and mouth breathing, and children with allergies. So that is what I specialize in. I am also a lecturer at the University of Nairobi, where I've been there since 2007 till today. And I'm also a lecturer at the Aga Khan University, where I've been there from 2006 up to today. And very, very occasionally, I will treat adults with small coughs and colds, but I am primarily a pediatrician. Sometimes an adult will require an allergy test, which is what I do. And in that case, I do treat the occasional adult, but my love, heart, and joy are my children, and I am a pediatrician in training.
We are now experiencing the cold season in Kenya, and many people are getting the flu, though people do not want to treat the problem because they are afraid that it could be the COVID-19 virus. What can you advise such people?
Jasmine, you are right. Right now, it's the cold season, and Nairobians are not used to this cold weather that we're getting right now. Everyone has got their jackets out right now. And yes, you are right. Because of this, and because some children are still in school as the term is ending, a lot of coughs and colds are going around. And there's, of course, a lot of fear and paranoia every time somebody gets the common cold is this COVID? Is this not COVID? Um, in this time where all of us have gone through this pandemic for such a long time, and a lot of us have unfortunately also lost a little bit of patience, we are now no longer sticking to the plans the way we used to earlier on. My advice to everybody is as follows: that not only do you need to keep yourself safe, you also need to keep your relatives and friends who are around you safe. So if you have signs of COVID, it is prudent and wise to go for the COVID test, not only to confirm whether you have the disease, yes or no, but also to protect the loved ones around you from getting the disease. It is only because 5 and 8 months ago people did not do that that is leading us to getting this pandemic into ever worsening situations. But there's always a time for us to turn back the clock and say, hold on a second, what can I do for my country? What can I do for my people? And so I would strongly suggest that if you have symptoms of COVID, you must go for the COVID test, and at bare minimum to isolate yourself as well, as you await for those results to come through. So testing is of mandatory importance.
There's this thing where we have now seen children being given inhalers at when they go and visit a doctor, and this is because probably they've gotten a cough that is stubborn, it's not going away. And for a long time, we have known that inhalers are used by people who have asthma. So why are children being given these inhalers?
Inhaler therapy can be used to treat asthma. Most of the time, when we're treating asthma, Jasmine, we use two inhalers. One is called a bronchodilator. Sorry for the bigger medical terms that we're going to use, but it's important for our listener to be aware of these things. And a bronchodilator simply means that it opens up the pipes in the chest and allows the mucus and the debris that is in the airways to come out of the chest so that the child can then, or the adult for that matter, can then breathe more comfortably. So asthma is treated by using this bronchodilator whenever you are coughing and wheezing. But there's also another inhaler that is used that is an anti-inflammatory inhaler. And this anti-inflammatory one is supposed to reduce the heat and the inflammation in the pipes in the lungs and make it easier for you to breathe and also prevent you from getting sick next week and the month that follows. Now, most of the time, if a patient is given an inhaler, it is for asthma, but there are also other slightly rare conditions where inhalers can be used. For example, in adults, there's something called COPD, and in children, it can also be used for things called bronchiolitis. Again, I'm sorry for the words, but the message to the audience is that just because you're on an inhaler doesn't mean that you have to have asthma. There are also other conditions that can be treated by using an inhaler. When I am treating the common cold, Jasmine, I'll tell you some of my favorite drugs. So, for example, say we are a child who is like 3 or 4 years of age, because that's normally who it's affecting. The parents will tell you that this child is having a blocked nose or it's a runny nose and the child is struggling to breathe through the nostrils, etc. And one of the best medicines that one can use for this is called saline nose drops. And saline in the land of medicine, Jasmine, means it's a salty water solution made in the consistency of tears. So, truth be told, you're not actually giving your patient medication when you're using salty water nose drops because they are made at the level of salt of the tears. And you can put this in the nostril 3 times in a day, or even 5 or 6 or 7 times in a day, and it is completely safe. So, that is a non pharmaceutical medication that I would use to open up the blocked nose. I am not fond of using antihistamines for the common cold. It does not work. If you read the textbooks of medicine, etc., it tells you that you shouldn't use antihistamines. Yet you will see a lot of colleagues using this, but I believe that there's also a lot of pressure from the public to sometimes medicate and issue these medications that don't actually work for children. So that is how I would treat nose blocks secondary to the common cold in children. Also remember that a lot of these medications that are antihistamines also have 6 to 7% of alcohol in them. And it's important to remember that beer has 3% alcohol, but some of these antihistamines, especially the older generation ones, have up to 6 to 7% alcohol. So please read the labeling very carefully. I wouldn't want to give 6% alcohol to my child. I wouldn't want you to do it to yours.
What are some of the natural remedies that can be used to prevent and treat the flu instead of using pharmaceutical drugs? And please specify for different ages, starting from days old to senior citizens having other health issues. I think that's something that our listeners would really like to know.
When you're treating the common cold, not only do you have nose blocks like how we've discussed in the past, but you also have a very irritating cough. One of the best medications to use for an irritating cough is honey, and several studies have taken place not only here in Kenya but worldwide, showing that honey is a safe and effective cough mixture not only for children but for adults. It's important to also remember that when we're talking about medications such as honey for children, it should be used for children who are over the age of 1 year and onwards. So that is one of the best cough mixtures that you can use to treat the common cold, secondary to the coughing symptoms, secondary to the common cold. Um, in Kenya and in many other countries, you will find an abundance of cough mixtures and mucolytics and antihistamines and expectorants and all these kind of medications called cough mixtures. And it's important to remember that the WHO banned all these medications around the world in 2003, but it is still available, unfortunately, in some countries. It is also important to understand that in the textbooks of medicine, that in the textbook of pediatrics, that in the textbooks of pharmaceutical teachings, that cough mixtures are not advocated for at all and are actually banned. The Kenya Pediatric Association, the Allergy Society of Kenya, the Kenya Medical Association, and various other bodies that we are all aware of locally have all strongly encouraged us to completely stop these practices of prescribing cough mixtures, and so cough mixtures should be stopped. However, when you're fighting Jasmine, a shilling company and a billion shilling industry, of course, there are going to be a lot of powers that are going to try and prevent uh, the spread of this knowledge going out to the public.
What can someone who has honey allergies take to treat common cold? The people who have honey allergies, as I've had before. So, what happens to those people when they need to take the honey for treatment, but now they're allergic to it? So, what else can they take instead of honey?
Jasmine, contrary to popular belief, it is very rare to have allergies secondary to honey. What people normally have is an intense dislike of the intense sugar in, the sugary content of honey, and they don't like the intense sweet. So, what I would suggest for somebody who has that kind of problem is that if you can dilute the honey with a little bit of warm water and put in a few drops of lemon juice, that kind of takes away the super sweetness of the honey and still does the job at the same time. But you are right, Jasmine. There are in very, very rare occasions some people who are actually allergic to the honey, but that is usually secondary to the pollens and the flowers from the local area from which the honey comes. So, say for example, we are having an issue with honey coming from the eastern province in Kenya. Then, if you try and get some honey from the coast province, chances are that the flowers that are there will have pollens that are of a different nature, and so when you have the coastal honey, you should be okay. So try changing the area of location that you derive your honey and see if that makes a difference.
When children cough to a point where they throw up, what could be the matter? The child might be well all day, but when it's supper time, when they are feeding and they have to eat, the problem starts. They start throwing up. They cough, cough, cough until they throw up. So, what's a problem?
Jasmine, there are some children who, when they have a very bad cough and a cold, they can cough so much that they end up vomiting thereafter. That is actually not the world's worst situation, because what is happening is that all the mucus in the airways is actually being attempted to be brought out by the patient. So we don't have an issue with that happening unless it happens very many times in a day. But of course, what one needs to ask at that point in time is, why is my child coughing? Is it a viral infection? Is it asthma? Is it bronchitis, etc.? And to seek medical help from the caregiver if what you and I have been discussing today, for example, using honey, etc., is failing, that then one needs to move on to the next part and ask where the cough is coming from.
Please let our listeners know where they can reach you in case they want to receive your services or in case they want to bring their children to you or just to get some advice on how to handle this season of the cold weather. Just let them know where they can reach you.
I have my practices, Jasmine, at the Aga Khan University Hospital, which is where I have my private practice and where I also work for the hospital. In this time and age, Jasmine, anyone can be hunted down. If I type Jasmine's full name, I'll also find out where you are, where you work, etc. So if you just Google my name, Dr. Adil Waris, it's the contacts are on the internet, and I'm happy to serve our little countrymen with pleasure.
On July 23rd, 1976, the first cases of Legionnaire's disease was reported in USA after 4,000 delegates from Pennsylvania chapter of the American Legion met at the Bellevue Stratford Hotel. So that's how the disease got its name. However, several days later, many attendees of that legion became sick, and 22 of them died from the illness. This disease is a type of pneumonia caused by the Legionella bacteria, which spreads through the mists, such as from air conditioning units for large buildings. So adults over the age of 50 and people with weak immune systems, chronic lung disease, or heavy tobacco users are the ones who are most at risk of getting it. The first line of treatment for Legionnaire's disease is antibiotics. Now you know. Ladies and gentlemen, that's how we end this week's episode of Mwalimu Kipepeo. Thank you for joining us, and don't forget to share this wealth of information with your friends. I am your host, Jasmine Wamboi. Let's meet next week for some more awesomeness. Goodbye and keep warm.